Dr. Phillips. I am an obstetrician and gynecologist practicing both obstetrics and gynecology with Cherokee Women's Health. I was originally born in Trinidad and Tobago, moved to the US a few years ago, and I've been practicing in New York and North Carolina and now here in Georgia. So the reason that I became an OBGYN actually was initiated many years ago. Growing up in the Caribbean in a family that had a large number of women really opened my eyes to the fact that women actually control the dynamics in a household. So both in my immediate family and my extended family, I realized that, once the women were physically and emotionally healthy, then things went smoothly. When they weren't, there was a lot of chaos. And so once I affirmed that I wanted to be a physician, I thought, well, the greatest impact that I would have was if I was serving the women in communities. So while I enjoy the hype of delivering babies, while I enjoy life-changing surgical procedures, I really feel called to educate women. I also have a master's in public health, and that really gives me the advantage of reaching women in the communities. So when I'm out in the field, but in the office, just being able to discuss different topics. So whether it's contraception, whether it's family planning, whether it's menopausal issues, a wider scope in a different way and from a different viewpoint is what I like about the fact that I'm able to educate. And so I like both obstetrics and gynecology, but being able to educate patients about specific aspects of obstetrics and gynecology is my passion. A big part of fulfillment for me comes with serving. Growing up as a child, my dad, who wasn't a physician but was in public service, would always say that it's in helping others and in providing a path in which others could succeed that you really have done your part in society and in this world. So, he used to always sing that song, if I can help somebody as I pass along, then my living would not be in vain. And I've always embraced that, so much so that when I was on maternity leave with my last two babies, my urge and desire to go back to work had to do with the fact that that fulfillment of serving those who I didn't innately have a responsibility for was just missing. I've been back and it feels great. It feels like I'm living my ideal life, being both a mom and a physician, and thirdly a wife. Well, maybe firstly a wife. But it's good to be back serving. It feels fulfilling, and I feel like it's my best that I bring to the table every day. So I was born in the Caribbean island, or on the Caribbean island, Tobago. Tobago is one of the smaller islands in the country, Trinidad and Tobago. So I grew up there, did my elementary schooling, secondary schooling, and in the initial parts of tertiary school there. For medical school, I then went to St. George's University in Grenada. There we had the option to get embedded in the US medical system or the British system, and I took advantage of both. So I went to the UK for a few months to do some clinical rotations, but decided to pursue residency in obstetrics and gynecology in the United States. So I spent 4 years at Staten Island University Hospital, graduated from there. Then moved to Western North Carolina with my husband and our then 8-month-old son, and worked there for a few years. We relocated in order to access better special needs care for that child who's actually autistic. So we do, though, have a total of 5 children. Our eldest child is actually in her junior year in university. I think my husband and I have set good examples. She also wants to do medicine, so she's in pre-med. Our 9-year-old who has autism is thriving in public school here. We have a 5-year-old who is also doing well in kindergarten, and we have twins who are about to turn 2, and they actually run things in the home. So entire families moved here. We're happy to be here. We're happy to serve this community, and look forward to meeting our new patients and population.